When I think of Mountain West physical therapy, I think about my whole body therapy. You actually, Ryan, specialize in the hand therapy?
Yeah, our specialist here is the upper extremity. We see mostly hands, and we work to rehab the hand, regain motion, regain full strength.
Okay. It's in the same office as the physical therapy, and Kyle, you're also with the hand therapy?
Yeah, I'm an aide. I assist Ryan in whatever he needs me to do.
Okay, so we've got hand and upper extremities. I mean, we're talking shoulder as well?
Yeah, we do some shoulder. The PTs do shoulder as well, and then we do exclusively elbow and hand. So our main area here is just the hand, elbow, and then some shoulder.
Well, let's talk about, why would I have to come in? I can think of carpal tunnel. That's one thing my mind goes to, but would I have maybe an accident with my hand?
We see a lot of trauma. Generally, the trauma that we see will first go to the doctor, and then after they're healing, they have a brace to immobilize themselves or a splint. And when they come out of that splint, they'll be sent to us to help regain full motion.
Okay. For those that are watching then and they're maybe experiencing some pain, what can you suggest?
We do free screening, so if you want to come in for an early screening to try and take care of some of that, we can definitely be a benefit for you. Coming in early can help prevent a mild problem from getting real bad, so we can kind of steer you in the direction for treatment and how we can help you out.
How would I know if it's something that needs your attention? Like if I've got just a constant pain?
Anything constant is probably good to come in. It's really hard to know. But just come in 2 or 3, 4 minutes. We can give you an idea of what you got and how we can help you out.
Well, and you say it's a free screening, so you're really not out anything. It's probably better to find out.
Right. It's not going to be a full 1-hour assessment where we sit down because it is free, but we kind of find out what's going on and say, hey, this can be fixed by doing X, Y, Z, or this is going to take a little bit more conservative treatment or possibly even going to the doctor. So
okay, well,
an idea for what you need.
While I've been here, I've noticed just a few of the different pieces of equipment that you have. Let's talk about these displays. Kyle, maybe you can give me an idea of something here.
Well, these are a few of our hand models here. This is a model of the muscles and the nerves in the hand.
And what might be a problem that we'd have to work on with that particular, either one?
Let Ryan take that.
There's a lot of, we hear about carpal tunnel. That's a common entrapment point right here, but there's actually 4 or 5 spots in the upper extremity that we can have nerve entrapment. So we will work on stretches or exercises to help prevent these nerve entrapments, which can be expressed by numbness and a lack of general strength.
Well, let me ask you, is this yellow representing the nerve?
That's
and when you say nerve
tunnel.
Entrapment, does that mean it actually gets pinched?
It gets pinched. Here's the carpal tunnel, cubital tunnel, even the radial tunnel, or Guillen's canal are different places that the nerve can become entrapped.
Okay, I guess I never really knew what that was, so carpal tunnel even was. So, and then you've got these. Do you actually form and make your own splints?
Yeah. We have material that is in big plastic sheets, and we cut it to fit people, throw it in a splint machine, and custom fit it to people.
I noticed that a young man was here earlier, and so you'll take from young children to adults, and you can form that then to fit specifically to the size of the arm.
Right. One of the benefits of custom splinting is that you can take it off, whereas a cast you can't take it off, but you can take it off, you can clean it, and it is form fitted. So if you have a certain position in your arm that's a little bit unique, it can form fit and immobilize that for you. So.
What issues do you see more often that I might not be aware of that you service here, like trauma or carpal?
We will see a lot of repetitive motion. So in the industry, you see patients that do the same thing over and over. And so if you're doing a lot of the same thing over and over, you're more likely to have an injury or tendonitis. So we'll see a bunch of that.
See, that's another thing. Well, I love that you make suggestions to the audience, because if a factory worker or something that's doing that repetitive motion, that could cause some issue down the road.
Cause some issue, and sometimes if you just change 1 or 2 simple things, you prevent that one motion that is causing that tendon or that irritation. And it doesn't take too much of a change to get some good results with that, especially if we see it early on.
Okay. So some things might not require a splint. Some things it requires just you're going to teach us the movement. Like if something had happened and I have this much movement, but you need me to go to there, you're going to work on getting my 100%?
Right. There's a lot of different, there's just a whole variety of things that can cause contractures. The best thing is if you have an issue, come in, let us look at it, and we can direct you for what you may need to have done.
Well, Mountain West Physical Therapy offers so many different things here. You have such a wide variety, and I, again, think of the whole body, not my little hand. So you are the specialists that are going to take care of that. Let's tell everybody where you're located.
We're located at 2310 North, 400 East, just to the south of the specialty hospitals.
And it's in the building that has that red roof, so it's easy to find, and you're on the east side.
We're on the back, so just come around the back, and we're the ones with all the names on the door. Yeah. So come in and see us. We'll be glad to see you.
And all those names on the door mean they're the specialists. So thanks so much, you guys.
Okay, thank you.